It is Psoriasis Awareness Month, and more than 7.5 million people are impacted here in the U.S. It can cause irritated and itchy patches on the skin, and the symptoms can be mild or for some severe.
Dr. Sandra Lee is here to talk about this disease, and it affects so many people. I feel like I'm almost hearing about it more, like some of my friends who have had babies.
I think a lot of celebrities are pretty open about
I remember Kim Kardashian many years ago. Talked about it.
Many. I mean, it's 30 out of 1,000 people, so 3% of the world, I think, essentially. And I mean, it's a condition where you have this disorder of the immune system, so your skin cells like produce too fast, so you kind of get this thickened scale. It is very commonly in certain areas of the body. It's it's very common to see in your dermatology practice. It is not life-threatening. That is the main thing that you need to drive home.
But it can flare, right?
It is both like physically and emotionally, upsetting to people because you can't. It's in areas that oftentimes you can see, most commonly elbows, the knees, the scalp. It can happen. You can also affect your nails. You can get arthritis with it. So a lot of different things. And it's just something that we really, in the past just 2 decades, we've really kind of figured out a little bit more about what causes it. And we're really getting some great treatment. So that's
let's talk about that, because I know it's very difficult for people who deal with it. They can be very uncomfortable at times or self-conscious. So how should you be treating it?
Yeah, well, so self-conscious. I mean, really, like essentially they can shed. You can find like piles of scale like on the floor and things like that. So the things that you want to do are really something that you would use, like even in acne, salicylic acid. These things are really probably pretty mild for you. These are more for acne, but you can see that even with acne, we use salicylic acid. That is a chemical peel acid that helps to kind of exfoliate your skin. But at higher levels, like with some of these shampoos, you can find over the counter, Nizoral and there's Neutrogena.
Now, you'd use this on your skin or just
you want to use that on your scalp? Yes, that will help. Tar shampoos too. That's all sort of old school kind of treatments because there are new and great like moisturizers and things like that. There are some that are more like sort of like even mentioned, they're really good for psoriasis because they'll kind of help to coat the skin. Yes.
I am a little surprised with the acne stuff. I would think that it would
dry it out.
Well,
so is there like a 1, 2, 3-step program?
It's more no. We don't want to use acne stuff, but I'm just pointing out that salicylic acid is an ingredient. Yeah, that you use both in acne and in psoriasis.
Got it.
But in psoriasis, we use a thicker variation.
Okay, I got you.
Is it typically over-the-counter stuff, or is it usually something prescribed?
No, there are prescriptions. Yeah, like cortisone. You can use over-the-counter cortisone, but much stronger cortisone or
you would get from the doctor.
Corticosteroid that you can get from the doctor. There's calcipotriene, which is also another topical. But really lately, like in the last 2 decades or so, we've got these biologic medications. You'll see commercials about them. There's various kinds. They are very expensive, and they are usually injection or IV, or some of them are oral pills, but those don't tend to work as well yet. And so they're really great. They will really clear people up. But for me as a dermatologist, I really try to assess how much this bothers them. Like sometimes someone will come in with one small patch and they'll drive them crazy. It affects their daily living, and some people might have it for most of their body and it doesn't really bother them. So you really want to assess that because, again, it's not life-threatening, but you can treat it, and you can really kind of treat them really well with some of these injections. It's just that they're expensive.
Well, that's what I was going to say. Does insurance cover this stuff? Because I feel like with the dermatologist, a lot of these things that work really well, insurance goes, nope.
Yeah, you don't some of them, Yes, exactly. But I mean, I think that
she's like, yes.
Financial aid, is financial assistance. I think they're very aware of it, these pharmaceutical companies, and they're really trying to help people. There's certainly people on our show that we get on psoriasis, and they don't have very much money maybe to afford it, and we get it for them for a good year or 2 or something like that. So I think there's really great things that you can do, and just know that there's something to help you. And also, if you have arthritis that is associated with psoriasis, it's usually like in the thumbs or the knees, and so sometimes they don't even realize that it's associated with their rash, and they'll use one of these medications, and their arthritis gets so much better. So that's one of the wonderful things.
Definitely good to know and be aware of, since a lot of people are dealing with this. Thank you so much for being with us, Dr. Lee. All right.